I have a pharmacist friend, lives in Adenta, always talks about how we ought to highlight what is wonderful about the healthcare system here in Ghana. And there is quite a lot that is wonderful about it. I think we ought to have a conversation just about that. So, as we all wish that things would be better, I mean, when you're ill and you have to choose between being treated here in Ghana and being treated abroad, I wonder which one you would choose. I'm sure you'd want to be treated outside the country, especially when you can afford it. But have you thought of your relatives, your friends, and people you know who cannot afford that luxury? So today's conversation is aimed at forcing the authorities to get things done right in our health sector. All right, how about that? Is it beyond us to remedy the situation? What should government be doing? What should you and I be doing? Ghana graduates about 750 medical students each year. And we all know this is not enough to improve the physician-to-patient ratio to an appreciable level. So what can we do about that? Private health insurance is increasing in the number of reputable health plans and lives covered. So how do health insurers approach growing their business today? Do health plans even value the advancing medical technology that improves healthcare quality, patient safety, patient satisfaction in network and product development? Do they think about these things? Can Ghana become a medical tourism hub like South Africa or India? Well, let's get started. Let's talk about it. Dr. Rodney Armstead is the president of Luca Health Medical Specialty Center. They also happen to be the health partners for the Commonwealth. And he's here with Percy Asare Ansah. He's the CEO of Premier Health Insurance. Gentlemen, how nice to see you both. Thank you so much for coming.
Good seeing you. Good to be here.
Excellent. Now, this is a conversation that, well, started last week, particularly because of the pending event, the Commonwealth Speaker Series, where we're focusing on healthcare. And these questions that we're asking about whether or not the quality of healthcare in Ghana can ever, be to a level where people would fly from their countries to get healthcare in Ghana. What's the simple answer, Doc?
The simple answer is yes. Ghana can be the hub, not only for its own country, but for West Africa. Luca Health Medical Specialty Center is invested in contributing to the comments you made earlier that there are some very good aspects of the health delivery system here in Ghana. And what we want to do is expand and build on that, because there's certainly a recognition of certain areas that are gaps. That's not unique to Ghana. There are gaps if you go into industrialized countries of specialties that don't exist, but we know that is more exaggerated in emerging economies. And so we are seeking to build upon and expand that opportunity to basically make it desirable for anybody, irrespective of their economic considerations, to want to have care here, and then drive Ghana to be the center of excellence, to be the hub for West Africa.
Now, one of the important pillars of this conversation is what needs to be done to get us to that point where we would be a destination. Now, in Dubai, we see adverts on CNN about how you can come to Dubai and get the best healthcare, and they show all these images of wonderful equipment and all that. What did it take a country like Dubai to get to the point where they can call for the world to come for the best healthcare? What will it take us to get there?
Well, coming from the health insurance background, I'm saying that if our healthcare financing is the best, we will be able to afford to pay for the best healthcare. So it is about our ability to afford whatever they are asking for. Healthcare provision across the world is expensive. So you need to put in place a very good model, a very good system that will be able to take care of you. And that is why I believe that when Ghana actually chose to do health insurance, which is a very good model, because all of us will be contributing to a pool, and out of the pool, everybody will feed from that pool. In that case, at any point in time, when you are sick and I am well, we have enough in the pool to be able to take care of you. The time that I'm sick, there is enough to also take care of me. That is the best system, but we need to improve upon it.
Sorry to cut in. I'm just thinking about countries where health insurance comes with their jobs and so forth, and they get deductions from their salary to get the very best health care. The United States is perhaps an example of that. But it occurs to me that even in a country as populated as the United States, we're finding people falling through the cracks because healthcare does not capture them. We're a nation of less than 30 million people. Is there ever going to be a price point for insurance that would be enough to provide all 30 million of us with the best healthcare?
Okay, it's a very important, it's a very good question. The model that Ghana is doing now, it's the social health insurance model.
Right.
Where the government is taking money from, let's say, SNP contributors. When you go, you pay small this, small that, and we put together to be able to finance it. But over the years, we realize that it is still inadequate. So if you look at the way service providers are still struggling for them to be paid, you realize that it is still not enough. We need to enhance it. And all the time, I keep saying that is why private players are very important in this equation. If private players come in and encourage people who can pay to contribute something small into it, we will be able to amass enough to take care of the populace. I could think of a product that we came up with, which was geared at getting people in the public service who take their money from the Controller and Accountant General to be able to get health care, the same quality health care. So at the end of every month, we take something small from them, which is reasonable, and they are able to access very good and quality health care, and they like it, yes.
That's good to know. Now, Dr. Armstead, so I'm diabetic, right?
Okay.
And I was diagnosed in another country. When I was diagnosed, I was given an army of experts to help me manage my condition. So there was a nutritionist, a dietitian, a podiatrist to check my feet, and all kinds of things. Came back to Ghana a few years ago and discovered that no such army is available to me.
Yeah.
Whether I go private or public, there wasn't a single podiatrist in the Republic of Ghana. So I'm wondering if even we're able to get the best, health insurance packages, will there still be some services that Ghanaians simply cannot access?
I think the answer to that is there will always be some services that Ghanaians can't access for reasons that have to do with that they are very limited. Maybe there are not enough, specialists, or maybe they don't exist. Part of what you need to solve for, right? And your example of a podiatrist is a classic example. Is you want to understand the real common disease processes, many of which that drive a lot of the burden, and then appreciate, what is in that armamentarium from end to end that allows you to deliver really good quality care. There are things that the system will be doing well, and then there are things that are gaps, for example, a podiatrist. And so what you then want to encourage, whether that's public or with a private partner, is to say, we acknowledge that that gap is there. Is that something that you're actually capable of doing? And so when you look at what we really try to address with Luca Health, we went the very route that you talked about. We talked to 700 and plus people we surveyed. We did focus groups, and they said these services are either challenging because we're having to wait too long for them, or they're not here. So we sought to basically address those to, again, build upon an infrastructure that is here, but then create and build upon that to basically expand the capacity in the country. So it's not unusual that we'll find these gaps. It's important that it's recognized and one seeks to figure out how they bring that service into the country. It's very doable. People are interested here. You just have to kind of create the structure and the attraction for physicians first to want to come, and then you figure out how to transfer the knowledge to expand and build upon that and add new providers.
So, I mean, that's promising, okay? So clearly, we are trying to address the gaps. And if we're able to afford it through good health insurance, then we ought to have a much better system. So tell me, if I had that choice, the choice I posed to the audience earlier, that you know, I can either get treated here in Ghana, or say I want to have a baby. I can either have the baby here in Ghana, or I can go and have the baby in South Africa or India or America, or whatever. Tell me why it's a better idea to have the baby in Ghana.
I must say that presently we have over 68,000 clients on our health insurance scheme. And year in, year out, we have a lot of people who assess to deliver. We have very good facilities in Ghana that will be able to take care of anybody. So instead of you expending between 2,000 to, let's say, 8,000 cedis for a delivery process, even the cost of plane ticket alone, how much is it? So I don't think that it is economically prudent to do that, because we have very good facilities in Ghana that will be able to take care of you. I keep saying that, yes, we have very good Ghanaian doctors and very good facilities in our country that we must all the time applaud.
You know, I've just been told by the producer we have a little bit extra time on this because it's an important conversation and we're all interested. So let's develop the process now. So if we're able to pay you know, for better health care, how do we solve the personnel problem? I mean, how is Luca Health finding them?
So that's a good question. I'm going to pivot into what you just asked me, but let me drive a point home off of what Percy said. Here's what's important. What's important is it's got to be more than us basically saying anecdotally that there are good services here. What does that mean? It means something different to you, it means something different to you, it means something different to me as a consumer of healthcare services. What you do is you drive data to basically say, here's how we perform. Here's how we perform at a facility, here's how we perform here, here's how we perform there. It's that kind of information objectively when you're using standards like that, where a person would then say, whether I can afford to go or not, I'm looking at this information and they're performing as well as anyone else that I'm going to seek to travel to. So it's important that we ground and base the fact that this is this has got to be more than saying, yeah, hey, this is what, you know, I got a good feeling about it. No, we've got really good information. So gathering that data and driving really good data is going to be compelling to convince people, you know, that it's safe, that the patient safety is good, the patient satisfaction is good. Then to answer your question, so I thought that was important to ground that. Here's how you have to get physicians here. You know, so there are two things that you're trying to do. You got your physicians that exist here, and you got your physicians that, you know, there are foreign physicians that do come here. So in either of those pools, when you come together, you have to create an environment, a training and a teaching environment that really kind of sets out a real good standard of specialty care that goes on. So the public system, it can do that. That's what it's supposed to do. Where those specialties don't exist, there are good examples where countries have partnered with institutions that basically transfer the training and the knowledge so that as it goes back and forth, you're able to then develop that kind of training capability in the universities here in the country, and now you're able to fundamentally bring interested students and graduates into that particular training specialty. So it doesn't have to be that if it's not here, it will never be here. You have to kind of come with a creative solution to kind of bring it here. And then finally, I'll say, as it relates to Luca Health Medical Specialty Center, our ability to attract physicians, first off, has to do with their belief in our vision and what we're trying to do, but an embracing of being able to come and practice in an environment where the scope of their practice isn't limited. So the technology, the tools, the environment by which they're accustomed to, it's essentially that they're doing that as the same thing they're doing in Ghana as they were doing wherever they came from, whether it's the US, the UK, the EU. That's an important part of basically creating the kind of energy and inspiring physicians to really come here, because they say, wow, I can do everything in Ghana that I was doing in the UK or et cetera. So that's important.
Yeah, that was a fascinating point you made about the data, so that we can make a real comparison. This is how good healthcare is in Ghana, this is how good healthcare is in India or South Africa. It's comparable, so why travel? I wonder, where do we begin gathering that data? Do you think perhaps insurance companies like yours have a role to play here? Do you have access to that sort of, do you have visibility of that sort of information? The number of people who come through your schemes, does that provide you with any level of information about the quality of healthcare that is available?
Well, I will say that we have almost all the data at our place, because apparently once you assess the facility, all your information will have access to it. So we can, at the click of a button, be able to know how many people are assessing healthcare for, let's say, malaria, for upper respiratory tract infections, for people who are assessing this, who are assessing that. So that data is immediately available. And formerly, it was a little bit difficult, but now, because of our IT infrastructure, we are able to get all those information immediately available for policymakers. So that is there. You'll be able to get it. In our case, for instance, now, we have a system where immediately you assess the facility, you get a text on your phone that you went to this place, you went to, let's say, local health. This is how much it is going to cost you. We have an app that once you download the app, it will be able to give you details of what you went there to do, how much it's going to cost you, and everything.
That's wonderful. So maybe we should see an advert on CNN soon from your company with some statistics of happy customers in Ghana, right? Maybe that will draw a few more health tourists, if you will. All right, let's talk about tomorrow's event. And of course, it's the Commonwealth Speaker Series. We're focusing on health. The partner, the health partner for it is, of course, Luca Health, Dr. Armstead's outfit. But of course, you're playing a role tomorrow, are you not?
Yeah.
Good. And maybe I'll ask you each to tell us why you chose to participate in this particular event.
Healthcare is very important to everybody. Life is such that God did not give us a second chance. He gave you only one chance. So you should be able to protect it in such a way that for everybody in our country should have serious concern about health issues. So once it's about health issue, I have passion for it. In any way that we have to contribute to make sure that our people are having the best health care and being able to finance it, it's, I would say, my passion. And it is not for only the government or for only the politicians, but also the private place as well. So I readily accepted to be there.
Dr. Ansah, perhaps you can also add what we can expect from Luca Health tomorrow.
Yeah, I think more than Luca Health, I think it's the things that really drove us to be a participant not only in the Commonwealth Series, but in the market, is to say that, look, life is no dress rehearsal, right? We get one shot at this, and with health, there, a lot of things are possible. And what we just appreciated was that as we looked at a parent company, Black Ivy, around all of the business and things that we're doing as far as our goods and services, we recognized that health was an extraordinary opportunity, particularly given the strength of our business. And so Ghana was inviting for a variety of reasons, but most importantly, it allowed us to come and demonstrate that you can actually bring really good quality services. And we believe that in this region, that this was just a real important area because of geography that will allow Ghana to differentiate itself as a hub and a center of excellence, and therefore then pull into West Africa. So the Commonwealth Series is actually an opportunity to, talk about, that as, an important, let's all embrace this, then how do we then, all work together, right? To achieve, to make this happen.
That's fantastic. And of course, I'm looking forward to tomorrow as well. Now, this is how you can participate. If you can be there, it'd be wonderful. It'd be at the British Council. But if you can't make it, here's what you can do. You can send through any questions that you want to put to the participants. Send them through to me. I'm on Twitter at the Kojo Youngson. I'm on Facebook as well, Kojo Youngson. Send through your questions to me, and I will pose them to the participants tomorrow. It all kicks off in the evening at 5 p.m. and I certainly hope you will be with us for the duration. It's an all-important conversation. Like they both said, you only get one life, so let's make it the healthiest we can possibly make it. Gentlemen, thank you so much for making the time to be with us.
Good,
It's been exciting.
thank you.
And I look forward to tomorrow.
Yes.